All right, welcome back to the deep dive. Looks like we've got a big one today, huh?
Yeah, this is a topic that I think resonates with pretty much everyone, right? I mean, who hasn't had at least a few nights where sleep just felt impossible?
You're telling me. And we all know how much that throws everything off, right? Like your mood, your energy, your focus. It's like a domino effect.
Absolutely. And it's not just the occasional rough night, right? For some folks, it's a persistent struggle, something they deal with night after night. And that's where we get into the territory of insomnia.
Right, insomnia. And that's what this deep dive is all about. We've got this, well, honestly, kind of massive stack of articles and research studies here, all focused on unpacking the mysteries of insomnia.
So our mission, if you will, is to sift through all this information, pull out the most critical insights, and really help you, our listeners, understand what insomnia is, what might be going on behind the scenes, and most importantly, what you can actually do about it.
Okay, so insomnia, where do we even begin?
Well, the first thing is to make sure we're all on the same page about what we're even talking about, right? The sources we've got here all point to a pretty straightforward definition of insomnia. It's basically when you consistently experience problems with how you feel or how well you function during the day. And those problems are directly related to not getting enough good quality sleep.
And it's pretty common too, right? Like we all have those nights where we toss and turn. But when we're talking about insomnia as a medical condition, that's a whole different ballgame, isn't it?
Absolutely. And the numbers are actually kind of surprising. Around 10% of people worldwide are dealing with insomnia that's severe enough to be considered a diagnosable medical condition.
Wow, that's a lot of people.
It is. And while it's totally normal to have the occasional sleepless night, it's really important to differentiate that from insomnia that's severe or that sticks around for a long time, what doctors call chronic insomnia. That kind of ongoing sleep disruption can have a real impact on your health and well-being.
Right. So let's get into the nitty-gritty of what insomnia actually looks like. Or, I mean, what are we really talking about here beyond just not sleeping well?
Yeah, so it's more than just lying in bed counting sheep,
Yeah.
right? Like you said, it's about not getting enough sleep overall, for sure. But it can also mean that the sleep you are getting isn't actually restful.
So it could be trouble falling asleep in the first place, right? Or waking up multiple times during the night and not being able to get back to sleep.
Exactly. And it can also involve waking up way earlier than you planned and then not being able to drift back off.
Ugh, I've been there. It's the worst. It makes for a very long day.
It really does.
Yeah.
And that brings up another important point, the fact that normal sleep can actually look really different from person to person. Some folks are naturally early birds, others are night owls. And even how much sleep we each need varies quite a bit. Some people are naturally short sleepers, and that's totally fine for them. Then you've got situations where people's sleep patterns are actually learned or adapted based on their circumstances. Like the military personnel our sources mentioned, some of them develop this heightened state of light sleeping as part of their training, so they're always kind of on alert, even when they're asleep.
It's like their brains are wired to wake up at the slightest sound.
Right. And then, of course, our sleep needs change drastically as we age, right?
Ew.
Think about how much sleep babies need, like 14 to 17 hours a day. Compare that to the 7 to 9 hours that's usually recommended for adults. Yeah. It's definitely not a one-size-fits-all situation.
Definitely not. So when doctors are trying to get a handle on what type of insomnia someone's dealing with, how do they break it down?
Well, they consider a couple of key factors. First, they look at how long it's been going on. Is it acute, meaning it's a short-term thing, or is it chronic, which is more of a long-term pattern and is often referred to as insomnia disorder? And then they also look at the underlying cause or what they think might be contributing to the insomnia.
So they try to figure out if the insomnia is the primary problem or if it's secondary to something else going on.
Exactly. And even though insomnia can feel really isolating when you're going through it, it's important to remember just how common it actually is. Our sources say roughly 1 in 3 adults worldwide experience at least some symptoms of insomnia. And then, as we mentioned earlier, about 10% meet the full criteria for an insomnia disorder diagnosis.
So if you're listening to this and you're nodding your head thinking, yep, that's me, you're definitely not alone.
Not at all. And that actually brings up a good point.
Yeah.
Let's talk about those symptoms. What does insomnia actually look and feel like?
Yeah, let's break that down.
So the research we've got here divides the symptoms into 3 main categories. First, you have the issues that people actually experience while they're trying to sleep, right? The actual sleep disturbances themselves. Then there are the daytime effects, which are all the ways that not getting enough sleep can impact you while you're awake. And then finally, there are the specific characteristics that define chronic insomnia.
Okay, let's start with those sleep disturbances.
So first up, we have what's called sleep onset insomnia, which is that frustrating experience of lying in bed, wanting to fall asleep, but just not being able to drift off.
I think we've all been there at some point, right? It's like your mind is racing or you just can't seem to get comfortable.
Right. And then there's sleep maintenance insomnia, which is when you can fall asleep okay, but then wake up in the middle of the night and have trouble getting back to sleep. This one's actually the most common type, affecting almost two-thirds of people with insomnia.
Yeah, that's a rough one. You finally manage to doze off, and then bam, you're wide awake at 3 a.m. with no hope of falling back asleep.
And last but not least, there's late insomnia, which is when you wake up way earlier than you wanted to and can't get back to sleep.
So you're up before the birds are even singing. And then, of course, there's the whole other side of the coin, the daytime consequences of not getting enough sleep.
Right. Those daytime effects can be pretty brutal. We're talking persistent fatigue, feeling like you're just dragging yourself through the day, and that general sense of just not feeling well. Your reaction time slows down, which, as our sources point out, can be super dangerous if you're doing things like driving. Your memory takes a hit, and it becomes harder to think clearly, like your brain is in a fog. It can be really hard to concentrate on anything.
Yeah, and it's not just the tiredness, right? It's like your whole mental capacity is reduced.
Absolutely. And it's actually pretty fascinating. Research shows that even those seemingly subtle sleep deficits, those nights where you maybe only get an hour or two less sleep than you normally would, can significantly impair your cognitive function. We're talking about things like decision-making, problem-solving, even your ability to regulate your emotions. It can really throw a wrench in your day-to-day life.
It's kind of scary when you think about it, how a lack of sleep can impact things like your work performance or even your financial decisions.
Absolutely. And then, of course, there's the impact on mood, which is huge. When you're consistently sleep-deprived, it's really common to experience increased anxiety, feelings of depression, and irritability. It can strain your relationships, make it hard to focus at work, and even zap the enjoyment out of your hobbies. Basically, it can make life feel like a real uphill battle.
Okay, so we've talked about the acute short-term type of insomnia, but what about chronic insomnia? When does a few bad nights turn into something more serious?
So, to be diagnosed with chronic insomnia, there are certain criteria that healthcare professionals use. First, the sleep problems need to be happening regularly, meaning at least 3 nights a week. And they need to have been going on for at least 3 months.
Okay, so that's the frequency and the duration. What else?
Right. And importantly, those sleep problems need to be happening even though you have the opportunity and the right environment for sleep. So it's not like you work in the night shift or you've got a newborn keeping you up. You've got a quiet, dark room, a comfy bed, all the things you need to sleep well, but you're still struggling. And finally, the insomnia can't be primarily caused by something else that would explain the sleep problems, like substance use, medications you're taking, other sleep disorders like sleep apnea, or a medical or mental health condition that's directly impacting your sleep.
It's like they're ruling out all the other possible explanations first.
Exactly. So once they've ruled those other things out,
Hmm.
and they're pretty confident that it's chronic insomnia, then they can start looking at potential causes and treatment options.
Which I imagine can be pretty complex. I mean, what actually causes insomnia in the first place?
Well, that's the million-dollar question, right? And unfortunately, there's no easy answer. The exact causes of insomnia aren't completely understood, but the current thinking is that it's usually a combination of different contributing factors.
So it's not just one thing. It's like a perfect storm of different influences.
Right. So for starters, there's genetics. Sleep patterns and predispositions can definitely run in families. So if your mom or dad had trouble sleeping, you might be more likely to experience similar issues.
Makes sense. It's like inheriting your mom's curly hair or your dad's blue eyes, but in this case, it's your sleep patterns.
Exactly. And then on top of that, there may be individual differences in how our brains are wired and how they function, particularly in the areas and with the brain chemicals that are involved in regulating sleep.
Like some people's brains are just naturally wired to be more alert or more sensitive to stimuli, which could make it harder to fall asleep and stay asleep.
Right. And then, of course, you've got all sorts of external factors that can contribute to insomnia. Like if you have an underlying medical condition, that can definitely mess with your sleep.
It could be something temporary, like having a cold or the flu, but it could also be something more chronic, like acid reflux, Parkinson's disease, or even conditions that mess with your circadian rhythm.
Right. That circadian rhythm is your body's natural 24-hour sleep-wake cycle, And when it gets thrown off, it can lead to all sorts of sleep problems. Things like jet lag and changes in your work schedule can disrupt your circadian rhythm and make it harder to sleep when you need to.
And it's amazing how much of an impact mental health can have on our sleep, right?
Huge. And it's actually one of the strongest links researchers have found. A large percentage of people with chronic insomnia also experience mental health conditions, particularly anxiety and depression. And that connection goes both ways, right? Anxiety and depression can make it harder to sleep, and then not sleeping well can actually worsen those mental health symptoms.
It's like a vicious cycle.
Exactly. And then, on top of all that, there are major life stressors and transitions that can really throw your sleep for a loop. Things like moving to a new city, starting a new job, going through a divorce phase, basically anything that causes significant upheaval in your life. And then there's the stuff we all know about those everyday habits that can either help or hurt our sleep.
Right, like our caffeine and alcohol intake, our bedtime routine or lack thereof, whether we're getting enough exercise, and how much we're exposing ourselves to blue light from screens before bed.
Exactly. And one thing that stood out to me in these sources was the fact that feeling unsafe at home and experiencing fear or anxiety specifically related to sleep, like if someone has nocturnal panic attacks or nightmare disorder, can also increase their risk of developing insomnia. That just seems like an incredibly difficult situation to deal with.
It does, and it really highlights the complex interplay of factors that can contribute to insomnia. So let's shift gears a bit and talk about what happens when insomnia becomes a chronic problem. We touched on the daytime sleepiness, but are there other potential consequences?
Definitely. When insomnia becomes severe or persists for a long time, it can lead to what's called sleep deprivation, which is basically your body not getting the amount of sleep it needs to function properly. And as you might imagine, that can have all sorts of negative downstream effects.
So we're not just talking about feeling tired and groggy.
Nope. Chronic sleep deprivation can actually increase your risk of developing all sorts of serious health problems. We're talking about things like depression, anxiety, high blood pressure, heart attack, stroke, obstructive sleep apnea, type 2 diabetes, and even obesity.
Wow, that's a pretty serious list.
It is. And in some cases, chronic sleep deprivation can even trigger or worsen conditions involving psychosis.
So clearly, this is not something to take lightly. If you're dealing with persistent insomnia, it's really important to address it. Speaking of addressing it, let's talk about how doctors go about diagnosing insomnia.
So the diagnostic process usually starts with a thorough conversation. Your doctor will want to get a really detailed picture of your overall health history, your lifestyle, your usual sleep habits, and the specific symptoms you've been experiencing.
So it's a lot more than just saying, hey, doc, I can't sleep.
Right. They'll want to know things like, when did the sleep problems start? How often do they occur? What have you tried so far to improve your sleep? Do you have any other medical conditions? Are you taking any medications? And what's your typical day like?
They really want to understand the whole context.
Exactly. And while there isn't a single test that can definitively diagnose insomnia, doctors will often use various tests to rule out other conditions that might be contributing to the problem.
So it's more about eliminating other possibilities.
Right. So, for example, they might recommend a sleep study, also known as polysomnography, which monitors your brain activity, breathing, heart rate, and other bodily functions while you sleep. This can help them identify things like sleep apnea, restless leg syndrome, or other sleep disorders that might be interfering with your sleep.
So it's like getting a detailed snapshot of what's happening in your body while you're asleep.
Exactly. And sometimes they'll do a simpler version of a sleep study that you can do at home, which can be a lot more convenient. They might also suggest something called actigraphy.
Actigraphy! That sounds like a superhero power.
Yeah, it kind of does. But it's actually a lot less exciting than it sounds. It basically involves wearing a small device on your wrist that tracks your movements and sleep patterns over a period of time. It can help your doctor get a more objective measure of your sleep quality and identify any unusual patterns. And then there's the multiple sleep latency test, or MSLT, which is used to measure how sleepy you are during the day.
So they basically see how quickly you fall asleep in a controlled setting.
Exactly. And that can help them determine if excessive daytime sleepiness is part of the problem, which can be really important for safety reasons, especially if you're driving or operating machinery.
It's like, okay, we're going to put you in a dark, quiet room, give you a blanket, and see how long it takes you to nod off.
Pretty much. So once your doctor has gathered all this information and ruled out other potential causes, they can start talking to you about treatment options.
So what are the go-to strategies for treating insomnia?
Your sources outline three main approaches: establishing good sleep habits, which is often referred to as sleep hygiene, using medications to aid sleep, and addressing any underlying mental health issues that might be contributing to the insomnia.
Okay, let's start with sleep hygiene. That sounds pretty basic, right?
It might sound basic, but it's actually super important. Sleep hygiene is all about those everyday habits and practices that can help promote good sleep. And the cool thing about sleep hygiene is that it's something you have a lot of control over.
So it's like taking ownership of your sleep.
Exactly. We'll get into the specifics of sleep hygiene in a bit, but first let's talk about medications. Because let's be real, a lot of people turn to medication when they're struggling to sleep.
Yeah, I mean, who hasn't popped a melatonin or two when they're desperate for some shut-eye?
Right. So when it comes to insomnia medications, there are a lot of different options out there, both prescription and over-the-counter. On the prescription side, there are controlled substances like benzodiazepines, which have been around for a while. And then there are the newer non-benzodiazepines, sometimes called Z drugs.
And those are typically prescribed for short-term use, right? Like for a few weeks at most.
Yeah, exactly. They're generally not meant for long-term use because of the risk of dependence and other potential side effects. Then there are the dual orexin receptor antagonists, which work a little differently. They target specific chemicals in the brain that promote wakefulness. So they essentially help block those signals and make it easier to fall asleep.
Interesting. So it's like a more targeted approach.
Right. And then sometimes doctors will prescribe medications that were originally intended for other conditions, but that also have sedating effects, which can make them helpful for sleep, like some anti-seizure medications, for example.
So it's not always a straightforward, here's a pill for insomnia kind of situation.
Nope. It really depends on the individual and their specific circumstances.
Makes sense. What about non-prescription options?
Well, the big one in that category is melatonin, which is a hormone that our bodies naturally produce to regulate sleep.
Yeah, I feel like everyone's talking about melatonin these days. It's like the trendy sleep aid.
It is. And while melatonin can be helpful for some people, it's important to be mindful of the dosage. Our sources specifically caution against taking more than 10 milligrams per day without talking to your doctor first, because higher doses can actually have unintended effects.
So even though it's available over the counter, it's still important to be cautious.
Absolutely. And then there are antihistamines, which you can also find over the counter.
Yeah.
Some of these medications, like diphenhydramine, which is in Benadryl, and doxylamine, which is in Unisom, can cause drowsiness as a side effect, which is why they're sometimes used as sleep aids.
So it's like taking advantage of a side effect to get some sleep.
Exactly. And then, of course, there's the whole world of herbs and dietary supplements that are marketed as sleep aids. Things like valerian root, chamomile, lavender, verbens. There are tons of them out there.
But again, buyer beware, right?
Absolutely. Our sources strongly advise talking to your doctor before trying any of these because they can interact with other medications you're taking or cause side effects, especially if you have other health conditions.
So it's always best to err on the side of caution.
Definitely. And, the third key treatment area addressing underlying mental health issues, that's something that often gets overlooked. But given how strongly our mental health is linked to our sleep, it's really important to consider.
So if someone's dealing with anxiety, depression, or other mental health concerns, that needs to be part of the conversation about their sleep problems.
Absolutely. Treating those underlying conditions can often lead to significant improvements in sleep quality, either directly or indirectly.
Okay, so we've talked about the causes and treatments of insomnia. Let's shift gears now and talk about prevention. Is insomnia something we can prevent in the first place?
That's a great question. And the answer is, it's complicated. While we can't prevent all the potential causes of insomnia, I mean, you can't really control your genetics or prevent every stressful life event, there are definitely things you can do to lower your risk.
So it's about being proactive, taking steps to set yourself up for sleep success.
Exactly. And a lot of this comes back to those sleep hygiene habits we talked about earlier.
So let's dive into those. What are some key things people can do to improve their sleep hygiene?
So one of the most important things is to establish a consistent sleep schedule. Try to go to bed and wake up around the same time every day, even on weekends. This helps regulate your body's natural sleep-wake cycle and makes it easier to fall asleep and wake up feeling refreshed.
It's like training your body to expect sleep at a certain time.
Exactly. And it's not just about when you go to bed and wake up. It's also about creating a relaxing wind-down routine in the hour or two before bed. This could involve taking a warm bath, reading a book, listening to calming music, or doing some gentle stretches.
Basically, anything that helps you de-stress and shift your mind into sleep mode.
Right. And this is where it's really important to avoid those screens, your phone, your laptop, your TV, because the blue light they emit can actually interfere with your body's natural production of melatonin, which is the hormone that helps regulate your sleep-wake cycle.
I know. It's so tempting to scroll through social media or catch up on emails before bed, but it's really doing us a disservice in the sleep department.
It is. It's basically telling your brain to stay awake when you actually want it to be winding down.
So ditch the screens, get cozy, and do something relaxing instead.
Exactly. And speaking of cozy, make sure your bedroom environment is conducive to sleep. Make it as dark, quiet, and cool as you can. Some people find that using blackout curtains, a white noise machine, or a fan helps create a more sleep-friendly environment.
It's like creating your own little sleep sanctuary.
Exactly. And then there are those everyday habits that can impact your sleep without you even realizing it, like what you eat and drink. Avoid heavy meals, caffeine, nicotine, and alcohol too close to bedtime,
So that after dinner coffee might not be the best idea if you're hoping to get a good night's sleep.
right? And on the flip side, regular physical activity can actually help improve sleep quality.
So even something as simple as a daily walk can make a difference,
Absolutely. And sometimes people try to make up for lost sleep by taking naps during the day.
which can be really tempting when you're exhausted.
I know. But if you're dealing with insomnia, it's generally best to avoid napping, especially in the late afternoon or evening, because it can actually make it harder to fall asleep at night.
So it's like resisting the urge to nap could actually help you sleep better overall.
Exactly. And, while all these sleep hygiene tips can be really helpful, sometimes insomnia is just too stubborn and you need a little extra support.
So when is it time to reach out to a healthcare professional for help?
Well, if your insomnia is lasting for more than a few nights and it's starting to affect your daily life in a significant way, like you're constantly tired, you can't focus at work, your mood is all over the place, that's definitely a good sign that it's time to seek professional guidance.
And especially if you're experiencing excessive daytime sleepiness or those brief episodes of falling asleep unintentionally, what they call microsleeps.
Right. Those can be really dangerous, especially if they happen while you're driving or operating machinery.
Yeah, that's definitely a sign that something's not right.
And it's also important to reach out for help if you're concerned that your mental health might be playing a role in your insomnia. Because as we discussed earlier, that connection between sleep and mental health is really strong, and it's important to address both sides of that equation.
So what are some key questions people should ask their doctor if they do decide to seek help for insomnia?
Well, for starters, it's a good idea to ask whether any underlying physical health issues or any medications you're currently taking could be contributing to your sleep problems. And if you think your mental health might be playing a role, definitely bring that up too.
Having these conversations can really help your doctor tailor a treatment plan that's right for you.
Exactly. Now, you had a couple of other questions that I thought were really interesting.
Oh, yeah, those were from some of our listeners who wrote in. One of them asked about pregnancy and sleep, whether it's normal for pregnancy to mess with your sleep.
Right. And the answer is absolutely yes. Pregnancy involves all sorts of physical changes, hormonal shifts, and even psychological adjustments, all of which can disrupt your normal sleep patterns and make it harder to get restful sleep.
So if you're pregnant and you're struggling to sleep, you're definitely not alone. And the advice from our sources is to talk to your doctor about it.
Exactly. And then the other listener question was about whether COVID-19 can cause insomnia.
Yeah, that's one that a lot of people are curious about.
And it turns out the answer is yes. While the exact mechanisms are still being researched, it seems pretty clear that COVID-19 can indeed affect sleep. It might be due to direct effects of the virus on the body and brain, or it could be related to the stress and anxiety that so many people have experienced during the pandemic.
So it's another example of how interconnected our physical and mental health are.
Definitely. So I think the key takeaways here are that insomnia is a really common issue, but it's also a really complex one
Yeah.
with lots of different potential causes and a whole range of treatment options available.
Right. And while it can be really frustrating and debilitating to deal with, it's important to remember that there are things you can do to improve your sleep quality.
Absolutely. And the first step is really understanding the problem, recognizing the symptoms, being aware of the potential complications, and then taking steps to address those underlying causes.
So pay attention to your sleep habits, make those lifestyle changes we talked about, and don't hesitate to reach out for professional help if you need it. There are so many resources available, and you don't have to go through this alone.
Exactly. And on that note, as we wrap up this deep dive into insomnia, I want to leave you with a little something to ponder. Think about your own sleep patterns and habits. Are there any of the factors we discussed that might be relevant to your own experiences? Maybe this conversation has sparked some insights or given you some ideas for things you might want to explore further, whether it's tweaking your bedtime routine, trying some relaxation techniques,